when you see yourself, you're like, oh my goodness.
I know. Well, anyway, here's what we do. Of course, the tooth got the filling right in the top there. The tooth has 3 roots up underneath the gum. Then the outside of the tooth looks about like that, and the gum's coming across here. You've got a big silver filling in one side of the tooth, and evidently had some decay that had come up under there. The problem is that deeper down in the tooth are these little spaces where the nerves and the blood vessels come down through the end of each root. When a cavity gets to the nerve can start dying in the tooth. That's what makes the pain start. And if you don't do anything and just tough it out, eventually the tissues die all the way down through here, and as they do, the germs that are in the cavity start living on the dead tissues and come through these canals into the bone up above the tooth. Then it starts to form an infection or an abscess and can swell up on you. So to prevent that, of course, we make the tooth real numb. I'll test it carefully to make sure there's no sensitivity at all as we go along. We make a little opening in the chewing surface, which has kind of already gotten started for us, so we don't have to do a whole lot there. But anyway, once we connect into the spaces here, we have a few instruments that just slip in, and the idea is to clean inside here and enlarge these canals a little bit so that we can fill them. When we place the root canal fillings in the canals like this, germs can't come through the tooth, so you don't form an infection. Or if you already have one going on, it goes away. And of course, the live stuff inside the tooth will be gone, so there's no more pain there either. And then after we're done, you get back to your dentist, and what they'll do is trim the outer part of your tooth all the way around, so a crown fits out here and it surrounds the tooth, protects it from breaking. So if you just fill in the hole in the center and keep chewing on it, the tooth could split open. The crown sort of circles the tooth and binds it tight together, so you're chewing force on it, can't try to break it apart. And so that's, in a nutshell, what we do, and we'll take care of it. It'll be real easy on you.
Got you.
Very good.